Imagine standing at a significant crossroads in your health journey. Perhaps you have received a diagnosis or are considering a major treatment. You have wisely sought a second opinion. Now you hold two distinct perspectives. How do you thoughtfully evaluate these different viewpoints and confidently choose the best path forward for your health and overall well-being? This can feel like a daunting task, but with a clear strategy, it becomes a powerful step in advocating for yourself. Comparing to medical opinions effectively means taking a structured and proactive approach. It involves carefully examining both points of view to understand where they align and where they diverge, specifically regarding the diagnosis, the expected progression of your condition or prognosis, and the recommended treatment plans. Your goal is to gather clear, comprehensive information that empowers you to make an informed and personalized decision. It is completely normal for medical opinions to have some differences, and this does not mean one professional is incorrect. Healthcare professionals bring varying levels of experience, specific areas of expertise, and even different interpretations of complex diagnostic images or test results. Medical science itself is constantly evolving, with new research potentially leading to diverse acceptable approaches to care. For instance, one doctor might prioritize a less invasive option due to their surgical background, while another might focus on a pharmaceutical solution. Understanding these potential reasons helps you approach the comparison with a constructive mindset, seeking clarity rather than just one single right answer. To systematically compare these valuable insights, start by preparing a comprehensive list of questions before any consultation. Think about what you want to achieve with treatment, any concerns you have about your recovery, or how the condition might impact your daily life. Next, ensure you ask the same core questions to both medical professionals. This consistency is crucial. Ask each of them directly. What is your specific diagnosis? What is your assessment of my prognosis or the expected course of this condition? And what are all of my treatment options, along with their potential benefits, risks, and side effects? This direct comparison will highlight any immediate differences. Then, you will need to focus on identifying factual differences in their assessments and recommendations. For example, does one professional suggest a particular type of surgery, while the other recommends a different, perhaps non-surgical therapy? Note these discrepancies down clearly. Crucially, ask each professional to explain the detailed rationale and supporting evidence behind their recommendations. What clinical guidelines are they following? What research studies support their suggested approach? Understanding the why behind their advice will provide valuable context. It is also vital to consider your own personal values, lifestyle, and long-term health goals. What outcomes are most important to you? Your personal preferences play a significant role in choosing the best path. Make sure that all your medical records, including test results, imaging reports, and previous treatment summaries, are readily available and shared with both healthcare professionals. Sometimes, a difference in opinion can simply stem from one doctor having more complete information. Finally, if you still feel uncertain after carefully comparing the two opinions, do not hesitate to seek a third opinion. A third perspective can often provide the clarity you need. This entire process is a prime example of what we call shared decision-making in healthcare. It is about you, as the patient, actively partnering with your medical team to choose a care plan that truly aligns with your personal preferences and life goals. The ability to easily access and transfer your comprehensive medical records, perhaps through secure electronic health record systems, significantly streamlines this process. It ensures all your healthcare providers have a complete and accurate picture of your health, making their advice more precise and helpful for you. Embracing this approach turns a potentially confusing situation into an empowering one. By thoughtfully and systematically comparing medical opinions, you transform yourself from a passive recipient of care into an active participant. This informed approach enables you to deeply understand all your available options, critically weigh them against your unique personal priorities, and ultimately select a health strategy that feels entirely right for your individual well-being and journey forward. You are taking control, and that is a powerful step towards better health outcomes.